Hi, my name is Jill Feldman. I'm a lung cancer patient and advocate. Thank you for joining us today on Hope with Answers. I'm here with Dr. David Carbone to talk about staging. But Dr. Carbone, can you first talk about how somebody is diagnosed with lung cancer?
Sure, Jill. Most of the time, cancer is suspected when you see a spot on a scan or feel a lump or a bump somewhere. But in order to determine whether it's cancer or not and what kind of cancer it is, it's called diagnosis, you have to do a biopsy. And that can be a biopsy of the lung if it's a spot in the lung, or even if there's a spot in the lung, sometimes we prefer to biopsy the liver or adrenal glands or other places to help us in what's called staging, because the first question is what is it? Second question is where is it? And I think it's important to know whether the cancer is spread outside the lung and to where it's spread.
So then why is staging important? Why is all of that information important?
Because for different stages of cancer, the treatment varies dramatically. If it's just localized to the lung, usually the best treatment is surgery, and molecular testing on the tumor from that surgery can be used to test for eligibility for clinical trials. If it's localized to the chest but can't be taken out by surgery, that's typically what's called stage 3 out of 4, and that is best treated with chemotherapy and radiation combination, and stage 4 cancers are typically treated primarily medically, which means giving drugs or medicines that go throughout the body. So it's very important to know whether a patient has stage 1, 2, 3, or 4 lung cancer.
And when you talk about molecular profiling, is that important in staging a patient with cancer, or is it just important in how you decide to treat?
So right now, the staging system does not include molecular features of cancers, but potentially in the future, we will be adding molecular features to staging staging description, because it really does make a big difference on the outcome of people with different stage lung cancer.
Okay, that's great information. Thank you so much for sharing it, and thank you for joining us on Hope with Answers.
You're welcome.